So, concentrating now on the hurricane study, can you explain to us how the vaccine works?
So it's a combination vaccine. It uses a DNA vaccine, naked nucleic acid, as a prime. DNA vaccines are very good at arming the immune system, but they aren't as potent as a viral vector. And so, in this case, the DNA prime is then boosted with modified vaccinia Ankara, which
I was responsible for the first study on vertical HIV infected kids, which occurs nowadays 10 years ago in Italy, in Rome. And as Merlin was saying, the vaccine appeared to be very safe and was very much immunogenic, so was able to induce immune response towards HIV in those individuals that have been under treatment for a certain period of their life. So we were confident that the vaccine will be safe and immunogenic. We still do not know exactly the effect of this vaccine on the reservoir, which is the final aim of this study. So try to understand if with this approach we will be able to decrease the reservoir size in these kids. Because actually I would like to say that within this EPIICAL consortium, our final endpoint is really to find new strategies towards HIV remission. So to interrupt the treatment for a certain period to this patient. This is our final goal, but of course this is one step towards this aim. Is not the final step.
And what is it in particular that makes you believe in this vaccine then?
Well, I think it's those attributes that we're looking at a population that probably has a smaller reservoir because of how early they were treated. They have a more resilient immune system because they're young people, and the addition of the Civerix we hope will augment what we already know to be a pretty immunogenic vaccine combination, the DNA and the MVA primate boost. So we have hope that we'll see something, but I'm confident it will be safe and will be an important first step in developing a rational approach to afford children and adults the opportunity to go off of treatment for a durable period of time.
Yeah, what is coming out even from this conference, and we heard even today that probably the last, let's say, immunotherapeutic approach will be like a mixture of different immunotherapeutic strategies, and for sure vaccination seems to be a key component of this mixture, but we need to add even other components. So for sure this approach will provide some evidence about where to go in the next future, and we hope also will provide evidence about the possibility to interact with the viral reservoir by inducing specific immune response.